Montenegro has discrepancies when it comes to statistics on children with disabilities.
Children who are not counted are effectively invisible, and that means that they're not going to go to school, their disability is not going to be detected properly or managed properly, and their rights are not going to be fulfilled.
Countries around the world and UNICEF are supporting the Washington Group on Disability Statistics in development of a new methodology for data collection on children with disabilities. Montenegro is the only European country which tested the new methodology.
In the Democratic Republic of the Congo, UNICEF and Handicap International have been distributing crutches, walking canes, adapted toilets and wheelchairs to internally displaced persons with disabilities.
In Haiti, it is estimated that there are about 800,000 to 1 million persons with disabilities. The vast majority of living in abject poverty. A lot of efforts are being implemented. For instance, right now we're working with the Ministry of Public Works to ensure that accessibility is considered within the new construction norms. If they are able to go to school, if they're able to have access to education, children with disabilities can be the fully active citizens that are able to contribute to the country's development as well.
Tanzania is estimated to have one of the largest population of children with albinism. These children are denied access to services. Many of these children do not experience their 30th birthday. Of course, children with albinism is one of the most vulnerable groups.
Here in Azerbaijan, we have 60,000 children with disability. We in UNICEF support the government in signing and ratifying the Convention on Rights of Persons with Disability. This creates a whole new atmosphere, an atmosphere where children with disability have rights which should be fulfilled rather than being objects of charity and of pity.
UNICEF-supported mind risk education is being conducted in 8 districts of Sri Lanka, in villages, schools, IDP camps and transit sites. Since October 2008, more than 520,000 people have been reached with MRE messages. New materials for children have been developed and field tested for inclusion in the national curriculum of 2011 onwards. UNICEF is also assisting the government and other organizations to provide capacity building and develop a victim assistance policy framework for Sri Lanka.
In education, we have supported the Code of Ethics for Teachers, whereby teachers have agreed on standards of caring for children who have disabilities. And we have supported the development of disability index in the school infrastructure, which influences the design of schools so that teachers and parents can ensure that schools, including sanitation blocks, are designed in a way that will be fitting and useful for children who have disabilities.
The establishment of pediatric developmental units. This is a result of a long-term partnership between UNICEF and Ankara University, where children are being early disabilities are being detected and dealt with, and involving, of course, the family and the community around this. It represents a shift in the whole pediatric thing, and it also can be an excellent model for other countries similar to Turkey to benefit from.
UNICEF is working with a variety of civil society partners, children themselves, and of course the government, to pilot some innovative programming for children. UNICEF is working with government to revitalize the health, education, social protection and child protection systems in the country, together with donors, communities, the government and children themselves.
From 2001 till 2008, with UNICEF support, 12 model inclusive schools have been created through a program of training of teachers and provision of resources to create the conditions for children with disabilities to be included in these schools. And today there are 145 schools which are inclusive, and are welcoming more than 1,700 children with disabilities.